Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn the classification of anticholinergics. Anticholinergics can be divided into two types. One, we have reversible anticholinergics. Second, we have irreversible anticholinergics. In reversible anticholinergics, there are of two types. One, we have carbamates. Second, we have acridine. Okay, carbamates include physostigmine, neostigmine, pyridostigmine, edrafonium, ambenonium, galantamine, donepezil, rivastigmine. Then acridine derivatives include tacrine. Then we have irreversible. Irreversible anticholinergics are of two types. One, we have organochlorines. Then we have carbamates. Organochlorines include ecothiophate, diflose, which is this. Diflose is disfluorophosphate. Diflose is disfluorophosphate. And then we have parathione, malathione, diazinon. Then we have carbamates. Carbamates are carbaryl and propoxyl. So these are the complete list of reversible and irreversible anticholinergics. Thank you for watching.
Thank you and thank you for watching.